Right, so we're staying with COVID-19 and so much is happening, such new terminology that is becoming a part of it. Tonight, it's all about the facts that you need to know and understand. We get so many questions about screening, for example, at the airport. What does that mean? So let's start off with our fact sheet today on COVID-19 with just the simple ones. You'll remember this from the last explainer we did. First of all, it was a new virus. It now has a name, SARS-CoV-2, which is severe respiratory syndrome, coronavirus 2. And the disease that SARS-CoV-2 causes is COVID-19. So that is just the first one. And let's start off by once again understanding the symptoms. And there are a number of them. Elevated fever, we have coughs, and shortness of breath actually happens a little later on, and some have also reported a sore throat, which is the major one, and some headaches. This is a term here that is important, asymptomatic, simply coming from the word symptomatic. Now, people who are asymptomatic are persons who may be infected but will not exhibit any symptoms. Now, these people are still able to transmit the virus from one person to another. Now, let's just talk about these symptoms right here, because now when it's talking about symptoms, you will hear a term called case definition. Now, what happens is this. Once a person meets what they call case definition, it means a person has been exhibiting all of these symptoms, plus they have traveled to a country that is affected by COVID-19, and or they have come into contact with a person who may already be infected or is suspected of being infected. When you have all of these three factors together, one, all the symptoms, two, either did travel to a country affected, or three, suspected to have come into contact, then it is said you meet the case definition. And then you would require a test, okay? And that test is what will confirm whether indeed you have the virus or not. And we'll get to the testing in a moment. But let us get to this one here. Screening versus diagnosis. So what are they doing at the airport? They're screening you. You may have seen scenes like this, somebody holding up a thermometer gun. Can the screening tell one at the airport or any port of entry whether you have the virus? No. This is because the process of screening is that of looking for the disease. It's sort of separating the wheat from the chaff. You are looking for the symptoms. At this point, you cannot say for sure whether one has the disease or not. And the screening process that takes place is looking for the obvious symptoms like a fever, like a cough. And this screening process involves the interview that we mentioned. So they would be asking you at a port of entry, which countries have you visited? Have they been affected? They will also be checking if you've been into contact with any. And this is what will be happening randomly in the streets of Nairobi, as was told to us by CS Mutahi Kagwe. So they will be asking you all of these questions. So again, from the screening, we'll be taking a look at if you have the symptoms or if you have been to a country that is affected or come into contact. At this point, you cannot say for sure whether one has the virus or not. For that, you would require the process of testing and diagnosis. Now, the test that is done after you have been said to meet the case definition is a swab, a throat swab. So they'll take some cells from your nasal area, take it to the lab, conduct a test that is known as PCR, polymerase chain reaction, which is done in a lab setting and will then tell you whether you have the virus or not. Here, I'd like to ask, many people, I'd like to pause and just tell you this, many people are saying, can we just have testing for everybody? You cannot test an entire population of 45 million people. No one in the world, no country is able to do that. Indeed, even in the US, this is something they are struggling with. An average testing kit and the process can cost you anywhere from 18 to 20,000 shillings per person, which is why they do the screening first to determine whether you meet the case definition for testing. Now, at this point, I'd like to just mention that if you feel unwell, this is what you are required to do. But before we get to that, I'm jumping the gun a little bit. Let's talk about this. Incubation period, you've heard of this. This is the time between when a person acquires the virus and when they start to exhibit symptoms. It is, for COVID-19, roughly 2 to 14 days, but many have talked of an average of 5 days. Here's the final one for you. Self-quarantine versus isolation. Well, Self-quarantining simply means keeping yourself away from others to minimize the risk of spreading it, or to minimize the risk of others acquiring it from you. And this is why you are asked to do so if you come from a country that has been affected or if you are exhibiting any of the symptoms. Isolation is separating those who are infected from the others to ensure that you are not infecting others. Now, if you meet the case definition, if you have any of the symptoms, what are you advised to do? Do not take yourself to the nearest health center. Dial 719. That number is 719. The reason you are asked not to take yourself to a health center is because you want to avoid, in case you are infected, you don't know yet, the chances of spreading the virus. Either you will be in a taxi, in a vehicle, in a public service. And remember, also when you get to the hospital, you may stand the chance of infecting others who are there, who are at even greater risk, because remember, their immune system is suppressed while they're in hospital. So once again, if you have any symptoms, do not go to a health center. Dial 719 and they will come to you. These are those definitions, and this is what they mean. That's our explainer here tonight. And we'll continue to explain to you and inform you of what needs to be done. When we come back, perspectives from Beijing, China, and the United Kingdom.